Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll focus on iontophoresis, an electrotherapy technique used to deliver medication through the skin. Iontophoresis is a method of delivering medication through the skin using direct current. Direct current is required because it flows continuously in one direction. The mechanism is based on a simple principle, like charges repel. The electrical current pushes medication with the same charge away from the electrode and into the underlying tissue. One important consideration is that direct current causes a charge to accumulate over time. If too much charge is delivered, it can lead to tissue irritation or even chemical burns, which is why careful dosing is essential. This table summarizes some of the most commonly used medications for iontophoresis. The most frequently used medication is dexamethasone. It carries a negative charge and is commonly used to treat inflammatory conditions, such as bursitis, tendinitis, and synovitis. Acetic acid is also negatively charged and is primarily used to help manage calcific tendinopathy. For pain relief, lidocaine carries a positive charge and provides a local anesthetic effect. Several other medications may also be used depending on the clinical presentation. Examples include salicylates for pain and inflammation, hydrocortisone for inflammation, magnesium sulfate for edema and muscle spasm, hyaluronidase for scar tissue and edema, zinc oxide for wound healing, and iodine for antibacterial treatment. The key concept to remember is that the medication's polarity determines which electrode is used. Negative medications are placed under the negative electrode, and positive medications are placed under the positive electrode. This follows the principle that like charges repel, allowing the medication to be driven into the tissue. Now, let's review the basic setup and application of iontophoresis. First, prepare the active electrode by filling it with the prescribed medication. Remember, the electrode's polarity must match the medication's polarity because like charges repel. Next, place the active electrode directly over the treatment site. The dispersive or return electrode is then placed at least one electrode width away to complete the electrical circuit and help distribute the current. Finally, set the treatment dose and intensity. A typical dosage ranges from 40 to 80 milliamp minutes, with treatment intensity commonly between 0.1 and 4 milliamps, depending on patient comfort and electrode size. Remember that dose equals current multiplied by time. Modern units automatically calculate the treatment time once the desired dose and current are entered. This allows you to safely deliver the prescribed medication while minimizing the risk of skin irritation. Finally, let's review some important safety and clinical considerations for iontophoresis. First, the precautions and contraindications are generally the same as those for other forms of electrotherapy. Examples include implanted electrical devices, pregnancy over the lumbopelvic region, active cancer, compromised skin, altered sensation, and other conditions such as active hemorrhage or peripheral vascular disease. The most common adverse event with iontophoresis is a chemical burn. This occurs because direct current can cause charge accumulation, leading to pH changes beneath the electrodes. Thermal burns can also occur with poor electrode contact or high skin resistance. Fortunately, these risks can be minimized by using larger electrodes when appropriate and keeping the treatment intensity as low as possible, while still achieving the desired effect. Finally, remember the concept of current density. Current density equals the current divided by the electrode area. To reduce the risk of skin irritation, current density should not exceed 0.5 milliamps per square centimeter. As a general rule, use the largest practical electrode, increase the intensity slowly until the patient feels a comfortable sensory response, and periodically inspect the skin throughout the treatment.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.